I've read your statements. You support reform. I'm not tying you into our plan or any specific plan. But you know this is no time to tinker. You can't rearrange the deck chairs on the Titanic. We got to change ships here.
All right, Vice President Joe Biden talking about how America needs dramatic reform in the area of health care. You know, and while some lawmakers were relaxing during their August recess, going on vacation, golfing, doing whatever, Congressman Paul Ryan was holding 17 town hall meetings on health care in his home state of Wisconsin in just 10 days. He's with us now to explain his own health care plan. He's a ranking member of the House Budget Committee. Thanks so much for being with us, Paul. First of all, we've been talking about the NBC Wall Street Journal poll. The president sitting at 39% approval rating. While that's bad news, the worst news is for Republicans, whose standing seems to be even lower on Capitol Hill. Why is that?
Well, I think the bully pulpit is trying to get this message out that we Republicans don't have anything to offer, when in fact that's really not the case. Many of us, as you know, Joe, have offered bold alternatives to this health care legislation and all the big issues of the day, whether it was energy, budget, the stimulus plan. We have been putting alternatives out there, but most people don't even know we've done that. And so they think we're just criticizing for the sake of criticizing, when in fact we really have a problem with the direction of these bills, and we have offered principled alternative bills.
Well, when you have the president being attacked the way he is at these town hall meetings, you see this Wall Street Journal poll that came out last night. Most Americans, if health care goes down, say they're going to blame Republicans in Congress. If you have a viable alternative, how do you get that message out?
Well, the problem we're going to have is we won't be able to get our alternatives voted on. We're not going to be, maybe Tom Coburn will put our bill on the floor in the Senate, but we're not going to be able to have the Republican alternative considered, because you know what? Democrats run the place. They have huge majorities in the House and the Senate. They have the White House. So if this goes down, it's because the majority didn't pass their bill, and they have chosen not to collaborate with the minority and make a true bipartisan package. This is not bipartisan. For bipartisanship to work, the majority has to be willing to collaborate with the minority. That has not occurred, and that is why we are saying, look, let's fix what's broken in health care, because really there are things broken, without breaking what's working in health care. And that's the big message I got from my town hall meetings.
Well, let me ask you about those town hall meetings, if I may. You had many of them, and we covered them over the summer, and we saw a lot of vitriol and crazy things going on. Is that how you would describe them across the board?
No, not in Wisconsin. Mine were very civil, actually. Like I said, I had 17, and I shattered the attendance records at my town halls. You know, at the end of them, I was asking for a show of hands how many people have never been to a town hall before. About 95%. They were very civil. Now, my town halls ran about 9 or 8 to 1 against the health care bill, and my district is, according to Charlie Cook, the most swing district in Congress. It's a district that Barack Obama won. And so what I did not see is some fringe right coming out. I saw real people spontaneously coming out to talk to their member of Congress with great concerns about the direction of all of these bills coming through Congress, but in particular the health care bill. It really isn't just about health care, Mika. It's about debt and deficits, the stimulus, the cap and trade bill, and then health care came along and made it personal. And that's what's getting people to come out of the woodwork. So I saw a spontaneous, civilized debate with great concern. People weren't saying bad things about the president. People were just really concerned about the direction of this country and this health care bill in particular.
You know, I heard Robert Gibbs at the White House a couple of weeks back talking about the ability of insurance companies to have monopolies in states or near monopolies. And so it got me thinking, maybe what we should be doing is allowing Americans to buy insurance across state lines. So
absolutely,
we get to compete. But before building another bureaucracy and getting the federal government more involved in health care, why don't we just try to break up the monopolies in these states and have insurance companies having to compete with other insurance companies for your money, for my money, for Americans' money?
And that reform is at the heart of virtually every Republican alternative bill that's been offered this year. So like he mentions Alabama, I think, which has something like Blue Cross Blue Shield has like 95% of the under 65 population. Well, let the people in Alabama buy insurance from the other 49 states if they want to and have real competition. I completely agree with that notion.